Record. All right, we are live. My name is Abby. I am one of the chiropractors here at Chiro for Moms, and I am with Jaidyn today. She is one of the occupational therapists here in our community. And so, welcome. Thank you. It's
Thank
early here
you.
for us.
Yeah, thank you for having me, Dr. Abby. I'm excited.
Oh, yay. I know we kind of like want to get the ball rolling, but first and foremost, can you just share a little bit about who you are, what you do, and how you kind of got into the occupational therapy world, I guess?
Yeah, so my name is Jaidyn Zimmer. I am a pediatric occupational therapist. So I work with kiddos who may be experiencing a variety of challenges that's impacting their ability to engage in their day-to-day routines. So we're really focusing on the child's strengths, looking at ways that we can support them to do what they want or need to do. So I've worked in a variety of settings. Occupational therapists might work in like an outpatient clinic. They might be working in a school with students. They may be doing early intervention. So working with babies, birth to 3, maybe going into their homes or going into their daycares, really meeting children and families where they are to be able to support them to build their capacity and help them do what they want and need to do. So that's a little bit about my background and what I do as a pediatric OT. I recently had a baby this spring. I had a little girl in April, and that is what led me to meet Chiro for Moms. They were able to support me and my little girl with a couple of things, so that led me here.
Wonderful. And I guess how, because I have a few friends in the occupational therapist world as well. Schooling wise, what just like a nice overview of like what has schooling looked like for you getting into the field?
Sure. So I went to Cornell University where I studied human development. So I got my bachelor's degree in that. And from there, I went on to get my master's degree in occupational therapy. So I was at WashU out in St. Louis. So I personally got my master's, but you can also get your doctorate. Those are the two typical paths that will lead you to occupational therapy. And after schooling, you do, we call it field work. So it's basically clinicals where you are under the supervision of another occupational therapist and mentor who guides you and gets you ready to go out into the world on your own as an OT.
So exciting. So
Yeah.
exciting. And so lead me into like question number one. When you look at a pediatric OT, what are the most common things that you guys are treating out in the field? And I know that varies, right, depending on where you are. But for you, what do you say is like the most common things that people would come in for?
Yeah, it's a good question. So sometimes people come in because their child may have a specific diagnosis that's impacting their ability to engage in their day-to-day activities. So we might be working with a child who has a diagnosis of autism, Down syndrome, ADHD. Maybe they just had a transplant or a complicated surgery or medical diagnosis, and that is impacting their skills. So that leads them to us. And at the same time, sometimes we are seeing kiddos who might not have a diagnosis at all, but maybe they're showing a delay in a certain area of their skills, right? So maybe we have a child who doesn't have a diagnosis, but they're showing some fine motor delays, and that's impacting their ability to use their hands to engage in handwriting or be able to use a utensil and feed themselves. Or maybe a child is having a hard time with sensory processing, and that's impacting their ability to tolerate a specific texture of clothes on their skin. Um, so sometimes we're seeing those specific diagnoses, and that's leading the children to come into us, but sometimes they're just showing a delay in an area, and we support them to work through that to be able to build their independence.
Seeing. It's kind of nice that, because I feel like in some fields you have to go in with a diagnosis, right? You have to come in for a reason. So having just like an area, and I guess for the community to know, it's just an area for support, kind of noticing child development delays, just having an area that you can go in and get that extra support. And so when people are looking at coming in, when you have those two options between an OT and a PT, which I say for us specifically are the most common therapists that we're typically recommending to because we're body workers at the end of the day. When someone asks you, should my child see an OT or a PT, how are you making that decision or that recommendation?
Yeah, good question. It can get kind of confusing,
Yeah.
but I always kind of bring it back to when I think about a PT, we're working a lot with mobility.
Okay.
So they're looking a lot at how the child's body is moving and functioning. So they're taking into account muscle strength, range of motion, balance, and all of that jazz, where we as occupational therapists are very focused on the functional tasks and these activities of daily living. So we may be looking at these specific barriers. Maybe we are looking at muscle strength or balance, but we're looking at it from a standpoint of how are these barriers impacting the child's ability to engage in their occupations?
Okay.
So, of course, kids and babies don't quite have jobs yet, right? But their occupations might look like playing. Maybe they have the occupation to, they've got to get dressed, feed themselves, explore a playground. So as occupational therapists, we're looking at how might these barriers be impacting their day-to-day routines? So it could be fine motor skills, maybe it's their visual motor skills, maybe it's sensory processing, maybe it's emotional regulation, kind of looking at this big holistic picture in how their little body is able to function in the world and how we can support them.
Amazing. So
Yeah, does that
how often
kind
are
of
you
help answer?
usually, what was that?
Does that kind of help answer the difference
Yeah.
between the two? Okay.
Yeah, because I know for myself, oftentimes when we're talking to patients and we're looking to make referrals out, sometimes it is breaking it down. Okay, so what is the end goal of us referring out? Because that helps us decide which route we go to. Because in the day, we want the kids to get better. And so whoever we can send to first rather than like bouncing them around, like try this person and then try that person. So kind of knowing like where to go first, and so that parents in the area know, or in general, know, okay, I know my child is struggling in some form.
Yeah.
Where should we possibly take that next step in going? And speaking of all of that, I know can be a really hot topic conversation, containers.
Yeah.
I know there's only, yeah. And there's so many factors that go in, but when it does come to containers, excluding car seats, just because we all know that car seats are needed, yes.
Yeah.
What should parents be looking for if they are wanting to use containers in the household? Are there not certain brands necessarily, but when is a child ready for those containers? Are they ever ready for those containers? What are your, I don't want to say guidelines, but how do you go about that conversation and those recommendations?
Yeah, it's a good question because, like you said, it is a hot topic, right? As a mom, I have a baby Bjorn bouncer sitting right around the corner that I used last night so that my baby could sit in there and have a safe place while I was making dinner, right? So containers, they exist. They can be a really helpful tool for us as parents, but it's a matter of thinking about how we can use them strategically and intentionally.
Mhm.
So I like to think of three things when it comes to containers. So number one, I like to make sure that it's not restricting movement, right? You know all too well, we want babies to move. That's how they grow, that's how they learn, that's how they explore. So if we are restricting their movement, it can lead to preferences in, maybe we're seeing some tightness off to one side, and that container can kind of make that tightness more pronounced. So really looking at, is this container restricting their movement? That's something I think is super important. Number two, we want to make sure that we're not putting babies in positions that they're not developmentally ready for yet, right? So there's a reason kids aren't jumping until they're 2 years old. If we're just talking from a physiological sense, that is when their little body is ready to jump. And if we're putting a 7-month-old in a jumper, I'm thinking about what is that doing to their little body, right? Can their muscles and bones and their joints, can it withstand that impact, or is it not ready for that? Chances are it's not ready for that if we're talking about just the typical trajectory of how babies develop. So making sure we're not putting them in a position that they're just not ready for yet. And also thinking about position wise too, if we're baby wearing, I love baby wearing, but we want to think about, are we making sure their hips are in a healthy position, right? If we're talking about a seat for a baby, thinking about the different options of seats and how those are positioning their hips. There are some seats that are better than others for kiddos. So really thinking about how it's impacting their body developmentally in that sense. And then the third thing I like to think about is making sure that this container is a tool for you as a parent and not necessarily the go-to hangout spot for your baby. So I understand, right? Sometimes you need a safe place to put your baby. The floor is always the best in my opinion. So they've got free range to move and groove, but that's not always safe or appropriate, right? Sometimes you've got a dog running around or older siblings. So you need somewhere to contain them safely. So again, making sure it's in moderation and you're doing it in a safe way. And of course, adding in time for movement after that as well. So those are kind of those three things I like to think about because it is a hot topic and these containers are huge, right? They're everywhere and they
Yeah.
can be really convenient. So how can we use them in a way that's safe and intentional?
No, it's nice that you broke it down into three. I think it makes it really easy when talking to other people, to other parents of like, these are the three things, because I'm not here to recommend a brand. I don't have any affiliates with the brand. Biggest thing, right? We want baby to be safe and I want baby to be able to move and
Mhm.
still getting that tummy time. You know, a lot of containers have them on their backs or
Yeah,
once they're ready, they sit down, but they still need that tummy time, that floor time to get to the crawling aspect. So they start sitting up and then they
totally.
start walking. So it's nice to kind of have like a real easy way just to do that. And then do you have, in terms of them like hip position, sitting up, when do you typically make that recommendation? So the baby born bouncer to say something like a bumbo, right? Where it's like a more upright. Is there a gauge that you typically tell parents like this is when you could make that transition to a different container?
Yeah. So if it's helpful, kind of for an example, my baby is just about 4 months and I have not used like a floor seat for her yet, just
Okay.
because I don't think she's quite ready for it.
Sure.
Um, I think you want to make sure that your baby has great head control if you're talking about a seat like that, right? So if you think about the baby Bjorn bouncer, she's got her head just able to chill and it's doing
Right.
most of the work for her. She can turn, but she's got that support.
Yeah.
Where if you did, let's say, the up seat, they've got to have really great trunk control. Otherwise, they're going to totally flop forward or flop backwards. So you want to make sure that they've really got that core control. And I want to see some early sitting skills starting to emerge as well. So if you've got baby on your lap, are they able to kind of activate those core muscles and show you that they're starting to be able to sit up on their own? Or are they totally just kind of flopping everywhere? If that's the case, they're probably not ready for that yet, and that's okay. So it's definitely on a case by case basis.
Sure.
I would say for my little girl, I would imagine within the next month, I'll probably take one out and test it. And that first time you use a seat like that, you want to think about what is your baby's position looking like in that container? Are they able to maintain a safe spot? Are they totally flopping forward and it's blocking their airway? Those are things we want to think about. So maybe that first time you're using that container, it's for 30 seconds and that's all they can handle. And you're like, okay, we're not quite there. And that's okay too.
Yep. And we move right to the floor and get some movement in there.
Right. And then we'll go right back on our tummy, move around.
Milestones. That's the other big question that I wanted to bring with you because in terms of kids not developing or not quite being ready, milestones live on a spectrum and on a range, as we all know. From your perspective in the OT world, when should we start being quote unquote concerned about those major milestones? Um, is it 3 months past for all of them? Is it are skipping some of them actually okay? Which I know is also hot conversation. Um, but when are you guys looking of like, okay, this is actually now a concern and like we need to do some more interventions versus let's just give it a little time. Let's just see what, each kid's a little bit different. They're gonna develop on their own, their own time frame. What's your take?
Yeah. So I think you hit on two important things, even in your question, right? So, first and foremost, every baby is different. We all have our unique timeline and how we grow, how we develop, and that's what makes us all awesome and unique. And at that same time, there is a typical trajectory that we're usually seeing when it comes to milestones and how we're obtaining them. And so, if as a parent you're noticing, hey, I was expecting my baby to be rolling around this time. I'm seeing, milestones when it comes to this timeline. I feel like my baby should be there and she's not quite there. Trust your gut. That's always my first answer is trust your gut, trust your instinct, because milestones can be super anxiety inducing for us parents. And I think about, you're waiting for your baby to roll and you're laying on the floor with them and you're watching them like a hawk and you're like, come on, you're supposed to be
Oh,
rolling right now.
roll,
You got to
roll.
do it. Right. They're going to pick up on your anxiety. They're going to feed on that. And so to a certain extent, even getting that support can help you as a parent to know I'm doing what I need to be doing to support my baby and help them get to where they need to be. Um, it can give you that peace of mind to get the tools that you need, or maybe it just gives you that reassurance of, yeah, my baby is doing okay, and we're going to keep chugging along. So, it's different for every milestone and their age, right? So it's hard to give a specific time frame of X amount of weeks that they're, maybe past an expected milestone. But I would say, let's say it comes to rolling and you're noticing, oh, I feel like my baby should have been rolling about a month ago and they're not quite doing it. Early intervention is so important and it's so beneficial because so much growth and development happens in these first 3 years of our kiddos' lives. So the earlier you can get that support for baby and for you, the more it can help both of you feel confident and at peace with their development and get them those tools that they might need.
Awesome. Milestones are so, they're not hard, but it's hard when, and how often are you typically seeing patients actually? Like weekly, typically, bi-weekly?
Yeah, it totally depends on
Okay.
the child and their goals and kind of how much support they're needing. So, a lot of times it will be once a week. Some children benefit from twice a month. Some children, maybe it's once a month and more of a check-in once they're kind of meeting their goals and they just need some support. So, it really just depends on a case-by-case basis of how much support it is that they're needing.
Sure. So when parents are talking to us, I like the instinct part because I see a snapshot of the kiddos. They're coming in and, when they're starting out, maybe I do see them, once every couple weeks, but then eventually it's, a month, 2 months out, a lot happens in a month. And
Mhm.
so just knowing that like parents, things, even if you don't think you do. And so that
Yeah,
instant part of like, okay, if you think they should have met a milestone, it never hurts to ask. And they could be right on track without you even knowing. But like you said, early intervention is always key, always.
totally. And it could be that maybe you make an appointment. In my case with my daughter, she had some tightness in her neck. And as an OT, I was like, oh my goodness, we've got to work on this. And
Yeah.
so I came in to see you guys because I knew she was just so tight and tense. And I actually scheduled a PT evaluation for a
Yeah.
few weeks down the road. And she didn't even end up needing it, right? It ended up kind of solving itself and we
Amazing.
didn't have to have that appointment. But just knowing in the back of my mind that I had that support there if I needed it was also really helpful and gave me a lot of peace of mind as a mom too.
I like that. Just being able put it out there. You have the support because you can always, back out if you don't need it anyways.
Yeah, yeah. And like you said, things happen and change
Yeah.
so quickly, especially from this young age that, maybe on a Monday you're thinking, oh my goodness, my baby's never gonna roll or they're never gonna crawl. And on Wednesday, they're zipping through the
They're
room.
rolling. It's
Yeah,
always when
exactly.
you're like manifesting it without like realizing you're manifesting it. And then, when you stop
Yeah.
thinking about it is when it happens.
You're like, I gotta get the baby gates.
Yeah,
Like,
right. Guess that came a little faster than we thought.
yeah, exactly.
Anything else, Jaden, that you want people to either to know about your profession, about pediatric care in the OT world itself? I know we're coming close on time here. So any closing thoughts, any recommendations, any advice for anyone that might be watching this?
Yeah, I think just, like we touched on before, trust your gut as a parent. I think when we're talking about milestones, like we said, it can be super anxiety inducing, but trust your gut. You know your child the best. You are the expert on your child. You see them day in and day out. You know what their strengths are. You know about things that might be tricky for them, and take advantage of the support that you have within the community. Even if it's just coming down to your peace of mind as a parent, knowing that you are getting them the support that they might need and being able to set them up for success with their development in the long term. So I think those are some important things to think about. And I'm excited that we got the chance to chat this morning.
Amazing. I am too. We've been juggling all the schedules, so it's nice that we were able to like
No.
find a little bit of time. Uh,
Yeah,
if you have any questions to anybody watching this, feel free to leave it in the comments below. Let us know. We are happy to answer any questions. I'm sure there'll be more interviews to come. This was just like a really nice overview on the OT world, and we'll be diving into specifics in the short term, but the long term. Everything
sure.
in between.
Yeah, yeah. And if anyone's looking for more information, I've been hanging out on Instagram on an account that I made to kind of share some developmental information, education, and resources. So that account is the dot playbooks. So if anyone wants to follow along for some more OT information in my journey as a first-time mom, feel free to hang out over there.
You know, I will. You know, I am. So,
Yeah, yeah.
amazing, Jaden. Well, thank you so much. Have a fantastic rest of your day, and we'll be chatting shortly.
Yeah, you too, Dr. Abby. You take care.
You too.
Bye.
See ya.